Hello everyone, my name is Spring Saldana and I am the Massage Therapy Program Chair here at Northwestern Health Sciences University. Do you ever experience headaches? I'm sure you do, it's quite common, so I want to show you some self-care techniques that will help with headache pain. So the muscles of our head and our face and our jaw, when they get tight, they can actually refer and cause headache type pain. So we're gonna start with some hair pulling. Yep, I said hair pulling. So if you don't have any hair, it's all right, or if it's too short, I will show you an additional technique. So we're going to start, I'm gonna show you the actual hand placement. You're going to be taking this part of your fingertips, that's what's going to be against your skull. So if you take your hair, grab a hold, make a fist. You got a nice wad of hair there, right? You're grabbing at the base, not at the ends of your hair. You can use one hand, you can use two hands. Make a fist. You're going to pull down gently. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Pull forward with that same grip. Relax your shoulders. 7, 6, 5, 4, 3, 2, 1. Pull towards the center. Now remember, we're not trying to cause pain here. That's that feel-good hurt that we're going for. 5, 4, 3, 2, 1. Excuse me. And then back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Release. Now you can do this all over your head. Okay, one hand or two hands. The next technique that I'm going to show you is more of like circular movements over the skull. Now, I want you to make claws. You're going to use your fingertips, firmly plant them into your scalp, relax your shoulders back and down, and you're going to make big circles. You're not moving the hair over the scalp, but you are moving the scalp tissue over the skull. Switch directions with your circles. Relax your shoulders. Very good. Now you can position your hands in different places. You can even position it right here with more of a baby claw, which is really nice because it just really feels good in this area. And then of course you would go in the opposite direction with your circles. Okay? Moving on to the forehead, we have a muscle, a very thin muscle called the frontalis on the forehead, and it's right on top of the skull, and it is a culprit for frontal headaches. I want you to take your thumbs, place them gently on your temples. This is not for pressure, it's just for stabilization. Bring your fingers in towards the middle of your head, relax shoulders and forearms, and we're going to make as large as circles as we can in one direction 3 to 5 times, and then switch directions 3 to 5 times. Relax your shoulders. Good. Bring it out to the edges here, and let's get the rest of that frontalis. 3 to 5 times one direction, 3 to 5 times opposite direction. Nice. We can go into the temples as well and do that here and switch. Doesn't that feel good? Okay, last but not least is going to be the masseter muscle. So the masseter muscle is our main chewing muscle. It starts right underneath the cheekbone arch and goes all the way down to the angle of the jaw. So I'm going to show you how to treat it both from the outside and from the inside. Let's start from the outside. You're going to take your fingertips, again, use your thumbs right underneath your chin. No pressure, just for stabilization. Bring your fingertips right underneath your bone and choose a direction 3 to 5 times on this upper part of the muscle, and switch directions 3 to 5 times. Oh, doesn't that feel amazing? Good. Bring it down towards the middle part of the muscle. Again, 3 to 5 times in one direction with nice circles. Firm pressure. 3 to 5 times in the opposite direction. Good. One more spot down here, not on the bone, right above it. 3 to 5 times, one direction. Oh, that feels so good. And then 3 to 5 times in the opposite direction. Wonderful. Now for this next technique I'm going to show you, we're going to be treating the masseter intraorally. So we are going to have our thumb inside of our mouth, and our thumb is going to be between our cheek and the outside of our back teeth or our molars. So I'm going to use a glove for this. If you don't want to, just make sure that you wash your hands. Really good idea for sure. You're going to be using these two fingers on the outside, so index and middle, and the thumb goes on the inside. The outside placement is in those three spots, here, middle, and lower. Your thumb is also following along with the outside placement, because what you want to do is get the masseter in between and firmly pinch it, okay? So just like when you're at the dentist, you're going to open your mouth, you're going to insert thumb, so it's in between your cheek and the outside of your teeth. Take your thumb, get it as far back and up as you can. Bring your fingers to meet it. Get a nice grip and then circle it. Nice and slow. 3 times, one direction. 3 times, opposite direction. Good. Smooth to the middle. 3 times. Oh, that feels amazing. 3 times in the opposite direction. Very nice. One more. Shift down, grab the lower part, pinch it 3 times, and 3 times. Good. Bring that out. Wipe off the drool. Now you'll notice that sometimes it feels like you're not actually being able to grab the muscle or the muscle slips out. Just gently reposition yourself, firmly grab again, and then start those circular motions. You can do 3 to 5 motions. It doesn't matter, even a little bit more than that to treat your masseter. Now what I want you to do for this last part is I want you to open your mouth. Open it wide. Good. Close it. What did you notice? Did you notice the difference between the side that you treated and the side that you didn't treat? The side that you didn't treat is probably tighter. So this is a great technique to help you with loosening that masseter muscle to help with things or symptoms that go along with TMJD or temporomandibular joint disorder. I hope you enjoyed today's self-care tip for headaches and headache pain. Be well.